Then we move to the shoulder. For the right shoulder, it is very important to think of sanguinaria. Sanguinaria has the typical nightly pain, especially when turning in bed. And in sanguinaria shoulder pathology, mostly the patients complain of a kind of heat sensation in the joint, in the shoulder, around the shoulder joint too. So mostly right-sided, and so on. Sanguinaria, we have the typical circumscribed redness and so on, and puts his feet out of the covers at night and so on. Many concomitant other pathology. For left shoulder, we very often think of ferrum phosphoricum. What is typical for the ferrums? Typical for the ferrums is that slight movement, slight moving of the joint makes everything better. We know, for instance, typical ferrum for anemia. What is typical for the anemia in ferrum? Notwithstanding the fact that the patient with anemia is so weak, he finds himself much better when slowly walking. This is typical for ferrum. This is very typical. But here we're not deviating from the shoulder. It's the shoulder. When we have to do with calcifications of the rotator cuff system of the shoulder, we have to think of solanum malacoxylon. Give it in a low potency in a 4C daily. And very often after a few weeks you have very good results. And solanum malacoxylon, I have found it many times after each other, can remove the calcifications from the infra and the supraspinatus tendons of the shoulder. In case we have a frozen shoulder, I once had a good result with frozen shoulder with magnesium carbonicum, constitutionally, but when we think of frozen shoulder locally, organotropically, we have to think of causticum. Causticum has to do in the end stage with rigidity, with contractions, with immobility, stiffness. That's typical for causticum. Not only in the shoulder, also in the knee or in the hip. Then we come to the elbow. Very often we see Hecla lava pathology in the elbow. We see sometimes cartilage or bone fragments coming loose in the joint of the elbow, very often, or arthrose of the elbow. Stiff elbow, as we said, immovable causticum. And writer's cramp is a very typical, a very interesting pathology, writer's cramp. When you have the diagnosis of writer's cramp, think of taxus baccata. Taxus baccata. Then we come to the wrist. In the wrist we have the ruta. Ruta is capable of removing ganglions of the wrist. I saw it many times. So the wrist, first of all, think of ruta. In women, do not forget actea spicata in wrist pathology. And when the wrist is very often very severely affected with rheumatoid arthritis going into arthritis deformans, we have to think of guaiacum. Guaiacum we know with amelioration, with cold and so on. Then we come to the fingers, and we know for arthritic nodosities and of the fingers we have many remedies, but when it concerns the proximal interphalangeal joint, which is quite swollen and which often points to arthritis, we have to think of pulsatilla, typical for the proximal interphalangeal joint, pulsatilla. Also we have the colophyllum. The colophyllum is a very important remedy, especially in the morning when the patient is not able to close his hand very tightly in the morning. It's quite stiffness in the finger joints and so on. Very often we have a very interesting pathology which is on the Ritz arthrosis, which is localized here. Pain is here. Ritz arthrosis between carpus and metacarpus of the thumb. Very painful. The best successes with Ritz arthrosis I had with Hecla lava, together or alternating with sulfur iodatum, low potencies, very low potencies. Then we come to the hip. Hip pathology is very strange. There are many total hips done, protheses of the hip, but very often we see that after a time, when one hip is operated, the pathology goes to the other one. That's nature. That is metastasis in nature, after suppression, of course. In the hip pathology, we see following remedies.